Thank you, Leska Hirlach. I want to acknowledge the amazing work of our frontline staff in our mental health services and all the organisations supporting people at the moment and thinking outside the box and in pivoting how they connect with people, like the school classes and sports. In Dublin 15, we are absolutely blessed with our network of community centres, places like Huntstown and Castleknock, where when people couldn't go to the community came to them and looked after our most vulnerable. And I'm very proud of the response that our local communities led through the lockdowns. There's no doubt that when it comes to our mental health that there is a lot of work to do, and I know that you are very committed to it. We talk about how COVID has exacerbated vulnerabilities across sectors, but it's also exacerbated problems for people as well. The pressure people are under at the moment is acute, but the effects of COVID on our society could last for years. So I really do think, and I agree with Senator Black, that mental health needs to play an absolutely key role in our COVID recovery. I'm concerned for older people locked away in their homes for months on end. People are bereaved, couldn't attend funerals for children and parents of special needs. Their routines turned upside down. Lost social and development milestones for children and young adults, business owners under stress, domestic violence victims, women who are bearing the brunt of pandemic parenting, homeschooling and domestic duties, expectant and new parents isolated at such a vulnerable time, COVID sufferers, frontline workers, the list just goes on. The Psychological Society of Ireland conducted research early in the pandemic which highlighted widespread distress amongst the general population in several counties, with specific reports of depression, anxiety, PTSD, reductions in life satisfaction, personal relationships, increases in loneliness. And interestingly, internationally and in Ireland, the age group that's impacted most by loneliness is actually those aged 18 to 34. So yes, there are pockets of positivity, but where there are acute problems, they are running very deeply. Access at the community setting has never been more important, and it's the foundation of mental health access, laddering up through primary care, specialist care and acute care. And I fundamentally believe that we need more public access to talking therapies. The increase in online access is great, and the National Crisis Text Line, but you know and I know we need more, and we need more staff. The budget today is over £1 billion and promises an increase in mental health community teams, CAMs, assistant psychologists in primary care and in jigsaw services. But Minister, we have had targets here before, and I'm wondering, we're still behind. When I look at the Delivering Special Mental Health Services report in 2019, we went from 69% of new development posts being filled in 2017 to 17% in 2018 and 32% in 2019, and funding for specialist community teams dropping too. And the PSI also conducted a survey where 92% of health and social care professionals said the current HSE panel system doesn't work well as a method of recruitment. So I'm just wondering where you are with that, and is COVID affecting the roadmap? The one last thing I'm going to say is that I'm on a board of a charity called Social Anxiety Ireland, a fantastic organisation. They need to be brought into primary care. Social anxiety is the biggest anxiety disorder in the world, and yet most people have never really heard of it or understand it. And as a charity, they are existing hand to mouth. And if you could see the impact that their 12-week programme makes, their group therapy makes, you would be amazed. So I will speak to you about that separately. My apologies. Thank you.